gentlemen, on behalf of the Integrated Health and Wellbeing Council, I welcome all of you to this lung cancer awareness session, which is supported by Roche. I am your host, Dr. Behjat, and today we will be discussing about lung cancer, signs and symptoms, risk factors, management, and patient perspectives. And it is my absolute pleasure to have with me Dr. P. Vijay Anand Reddy, who's the Director, Apollo Cancer Institute, Hyderabad, as the esteemed speaker for today's session. Sir, thanks for taking out time from your busy schedule and joining us for this awareness session. So I'll just start with the first question, which will be basically about how lung cancer develops and what are the two types of cancer, lung cancer, if we discuss about them in detail for our audience.
Yeah, thank you very much for inviting me for this awareness meeting, and pleasure to join this. Lung cancer is a very, very common condition in our country. If you look at the incidence, we have around 15 lakh new cases developed in general, total number of cancer cases that are developed every year. The last year, it was around 15 lakh new cases, out of which 2.5 lakhs are lung cancers, which is very significant number. And out of 2.5 lakhs, you are looking at, out of 22 lakhs of lung cancers, you are getting 17 lakh of them are dying. These are all lung cancer patients. That's a significant number. Unfortunately, this is what is happening, and the reason being the late diagnosis. So it's very, very important and imperative for all of us to understand early diagnosis helps a lot, and awareness is very, very important. Meetings like this would help the general public as well to understand what it is and why it is happening, all this.
Right, Dr. Vijay, right. Thanks for those data and numbers. And of course, we have heard that after breast cancer, lung cancer is the most prevalent form of cancer in India. Coming to because you said early diagnosis is important. So when we talk about early symptoms, because many a times the early symptoms, get the patient confused, because there are certain other respiratory conditions and the earlier symptoms of lung cancer might be, confusing for them. So what are some of the specific early signs and symptoms that you would advise individuals to, do not ignore if they are having such symptoms?
So most of the times, cough is a non-specific symptom. Unfortunately, most of the patients, even with the cold, they have this cough on and off, and they neglect it, and they keep on taking some antibiotics or the other. So that's the way we miss out on the diagnosis of lung cancer. So we need to be a little cautious. Any patient above the age of 35, 40 years, when the patient has cough, which is persistent, it goes on for more than 2 weeks to 3 weeks, you need to make sure that there's something, minimal investigations like a chest X-ray, we would get to know there's something going wrong in the lungs. And especially when you have a simple X-ray chest, and then you find some patches here and there, we need to definitely seek the attention of a cancer specialist or a pulmonologist to understand what kind of patch is that. Most of the times it could be infection, but we should always rule out malignancies in such situations. Besides that, a patient having cough with some occasional blood or weight loss, breathlessness, all these symptoms we should always be conscious about and then start investigating. Simple investigations would certainly get to know, simple X-ray would get to know that there is some problem in the lung and that we can investigate it further. For the high-risk group of patients, especially who are smokers and who get exposed to the factories, and so those kind of patients, we should be even more careful. Irrespective of the symptoms, you should go for investigations. These days, we have low-dose CT scans, which does not cause any harm to the patient. By simply doing that kind of a CT scan, which is done in just 2 minutes, we will be able to identify lesions, very small lesions in the lung. And identifying the small lesions in the lung is very, very important, because at that stage, you're almost 90 to 99% we can cure them. So do not ignore symptoms of cough, breathlessness, or blood in the sputum, which would certainly help us to diagnose lung cancer at an early stage.
Right. Thank you, Dr. Vijay, for that insightful, overview. When we talk about, because you've already, though I have kept it for the later part of the discussion, but since risk factors are, and when we talk about smoking, that is a major, major risk factor. So if you could just enlighten us more on the risk factor, especially when we talk about the two types of lung cancer, modifiable risk factors, non-modifiable, please give us some insight on that.
Broadly, we classify the lung cancer into a small cell lung cancer and a non-small cell lung cancer. So the most common is the non-small cell lung cancer. See, all the risk factors what we talk today usually go into these kind of cancers which are non-small cell. Commonest in non-small cell are adenocarcinoma and squamous cell carcinoma. These are the two non-small cell lung cancers that we commonly encounter with. And the other small cell cancers are quite rare in our country. And those small cell lung cancers behavior is completely different from the non-small cell lung cancer. So small cell lung cancer is quite nasty tumor. It spreads rapidly, although it responds to the treatment, but it bounces back very fast. So let us not deal much with that, not talk much about it as of now. We are not able to still conquer this small cell lung cancer unless and until you diagnose them in stage 1 or stage 2. Besides that, non-small cell lung cancer, certainly we know that these tumors have several targets in the tumor cell. We are able to locate them even in stage 3, stage 4, even in advanced lung cancers. With these adenocarcinomas and squamous cell carcinomas do have certain tumors targets which can be addressed directly, and we can give a good quality life to the patients without having much of an impact on the quality of life. We are able to control the disease for months and years together.
Right. Thank you, Dr. Reddy, for that answer. Coming to the detection part, because you also in the beginning of the discussion said that early detection is very important. It plays a significant role in, in the treatment outcome of the patient. So when we talk about early detection, what are some of the, and especially when we talk about stage 1, stage 2, how does that work? Do we, when we get a cell diagnosed, detected, how does the stage at which you are right now, does that differ with the kind of diagnosis that we are, going for? Because one basic test is there for detection. After that, what are the other important steps?
So basically, we need to look at screening. Unfortunately, screening is not mandatory in our country, but certainly we categorize the people, society into high risk and low and standard risk. High risk people should certainly go for screening. For example, people who smoke and chew tobacco, and people who are working in factories like asbestos and radon gas, those kind of people would certainly get screening done after the age of 35. Every year, a low-dose CT scan or a chest X-ray will be able to identify the disease and we will be able to cure them. So screening is mandatory to detect early cancers, early lung cancer, because it makes a huge impact in the overall treatment. Not just the cure rates, also the kind of treatment that these people require is very minimal. Simple surgery or radical radiation would be able to cure them if you detect them early. Starting from 90 to 100% cure rates versus 20% cure rates if they are stage 3, stage 4. So certainly early detection is very important. And standard risk for the normal individuals who are non-smokers can still develop lung cancer. So such people should not ignore the common symptoms like cough, breathlessness, a chronic cough which is not going beyond 2 to 3 weeks, is still persistent cough, should be investigated further. Any times when they cough out or spit out blood in the sputum, and if they are losing weight for the last 2-3 months for unknown reasons, they have to go for common screening methods so that we can diagnose tumors early. So these are the simple diagnostic tools which are not expensive, which make sense to every individual. It's not even going for a breakfast cost that you are spending for your own health. So I think screening would certainly help for a high risk more frequently, for a standard risk less frequently.
Right, Dr. Reddy. Thanks for that answer. Coming to the once you got yourself diagnosed, then when we talk about the treatment modalities, do they, of course they must differ from depending on the stage that the person is. So if you could just guide us through the different stages and what kind of treatment modality is followed for that specific stage.
A small lesion in the lung, which is easily seen on a CT scan, low-dose CT scan, or a X-ray chest, and if there's no spread to the lymph nodes, an early stage tumor, we call it as stage 1. And as long as the tumor is not big, it is still stage 2. So stage 1 and stage 2 tumors can be radically treated either by surgery or by radical radiation treatment. Both the modalities of treatment have got 90 to 95% cure rates in stage 1 and stage 2. You may require adjuvant treatment in the form of chemotherapy in stage 2, but otherwise most of these patients get away either by simple removal of the tumor, which we call it as a lobectomy, or by stereotactic radiation, which is again a non-invasive procedure, which is done in just 3 days every day for 5 to 10 minutes. So these two modalities of treatment are equally good, and the cure rates are more than 90%. But once it goes into stage 3, then it becomes difficult for anybody to operate, and even after surgery, the results are not that good. So once it becomes stage 3, it's a multimodality treatment in the form of chemotherapy, radiation treatment, plus or minus surgery. If it is stage 3A, we still consider surgery as one of the options. But if it is stage 3B, it is radiation and chemotherapy, plus or minus immunotherapy and targeted therapy. So the results would be drastically coming down from 90% to only 50 to 60%. So once it comes to stage 3, the results would come down. Stage 4 is a disease which has spread from the lung to other parts of the lung, or to the opposite lung, to the bones, liver, brain. Then it's called stage 4. That becomes incurable. And in incurable disease, fortunately, these days, we are able to treat them and control the disease for months and years together. Earlier, the patients in stage 4, the survival used to be around 6 to 7 months. Now we are going beyond 5 years, 6 years, and even 8 to 10 years in some of the patients. So fortunately, lung cancer is treatable because of the new drugs which have come into enforce, especially the targeted therapy and immunotherapy. We are able to identify certain targets on the tumor cells. We are able to boost the immunity of the patient, and then we are able to treat them with immunotherapy. The patients are doing long. The best part of this targeted therapy is we have very minimal side effects, and they are more effective than the chemotherapy. And the best part of the immunotherapy is that not only the tumor responds to immunotherapy, but also the sustainability of the response. Normally in the chemotherapy or targeted therapy, you have a response, but again, there's a high possibility the tumor might bounce back. Whereas with immunotherapy, once the tumor responds, the response is continued to sustain for months and years together. That is the best part of immunotherapy.
Thank you, Dr. Reddy, for such a detailed answer, because my next question was on innovative therapies, and you've talked about targeted therapies and immunotherapy as and it is indeed good to know that people who are there in 4th stage cancer, they have a extended lifespan because of such therapies. Coming to counseling as an important, because in your practice you must have seen people getting that diagnosis, those results, it must affect them mentally as well. So when it comes to counseling of the patient and of course the family and caregivers, so what is the approach towards that holistic journey of a cancer patient?
Excellent question. So basically, most important for any cancer specialist or an oncologist is counseling. So it's a disease of the family. Entire family gets affected. So we need to spend a lot of time when the patient comes to you, and the attenders who are following with the patient. You need to spend good amount of time, explain them the pros and cons, possibilities and options of various options available, counsel them in a positive way. Maybe that you may add 10 to 20% more to give them more positivity, that the results might be more good, and in those terms you should counsel the patients. And of course you have to give them an option of multi-modality treatment and multiple options that are available as of now, and what could be the best option. And besides that, when the patient asks you what do you think, what is the right option, should always relate that in case if that is my brother, I would do this. If that patient is my sister, I would do this. So that's the way you need to counsel them, and you have to counsel the family members as well. Because a patient undergoing treatment needs a lot of support from the family. The family support is immense, and both of them have to fight. It's just not the patient alone. Patient gets into the depression when he goes home. He's fine as far as when the patient is with you. So even the patient attendants need to be counseled a lot, and those people should constantly impose confidence in the patient, even at home, even after they go out of our clinic. So that matters a lot, and we have a psychosocial workers as well with us who keep in touch with these patients and keep monitoring them and talking to them now and then. Besides that, the best other way of counseling these patients is to make them interact with another patient who has already been treated and cured. So those things we do have, we call it as Freedom from Cancer group. There are so many social groups which are available, and those people who volunteer themselves to come and talk to these patients. And I have written a book called I Am a Survivor, wherein there are 108 stories of cancer survivors who have completed the treatment for 5, 10, 20 years and leading a normal life. And they have shared their stories. So if, a doctor always tells the patient that you're going to do well, you're going to get cured. But if that comes from a patient who has already been treated, it makes immense sense. They believe them more than the doctor. So it's always better to make a patient speak to another patient. So that's what we keep doing in our clinic. We have members and volunteers who will volunteer to speak to them, who are ready to identify themselves as a cancer survivors, and those people we make them speak with the patients who are recently diagnosed.
Right, sir, very rightly, because my next question was on how patient support groups can, provide solidarity, and you've already given us a beautiful overview on how, coming together of those patients and sharing their stories, it can make a lot of difference. And when we talk about awareness, sir, do you think now that we are using technology and we have so many digital platforms, because when it comes to cancer and lung cancer, to be specific, in India especially, we have a lot of, misconceptions, stigma associated with that. So do you think digital platforms and initiatives like this can play a proactive role in creating that level of mass awareness among the common people?
Yeah, so awareness is a constant endeavor from all of us. It's everybody's responsibility. So not just the doctors, it should be media, print and video media. So all these people, when you open an app, they will have an advertisement flowing downstairs. So all these apps who are developers should make it mandatory for them to have a part of the advertisement as a cancer awareness. It could be lung cancer, it could be oral cancers, whatever way that they can. They should feel the responsibility, or the government has to make it mandatory that awareness should be part of their advertising companies. So that should automatically enhance the awareness. I started my practice 30 years back. 10 years earlier, I used to get 80% of them in advanced stages. Now only 20% of them are coming in advanced stages. That definitely goes credit to the awareness every one of us are doing. It could be print or video, TV media. So those people also, every channel has to have a break in between and showcase some kind of an awareness clip that helps the patients a lot. So we are not talking about advertising, we are talking about awareness. So it has to become a mandatory thing for every social media platform to do some kind of an awareness. It could be you have just Women's Day to talk about breast cancer. It could be lung cancer day, so you talk about lung cancer. So it should be made mandatory. That makes immense impact on the patient. So when we do so many awareness meetings, I do perennially every month, every 2 months, a lot of awareness meetings, and patients do register, do come, and we are able to diagnose patients at an early stage. We have started a breast suit company. We have breast suit department. So patients, even small lumps and all, they are suspicious of lumps and they are coming to the hospital. So it definitely helps. In program like this, yes, people are listening to us in a Facebook. So that helps a lot. So I think it's a continuous endeavor. It's not the end of the day. It's not that one program. It's a continuous process. Everybody has to get involved from every angle. It makes huge sense.
Yes, Dr. Reddy, thanks for that answer. Coming to the preventable aspect of the disease, because of course, like you also pointed out, tobacco and smoking are major risk factors. So when we talk about modifiable risk factors, even pollution these days is also one of the, how can small changes, because of course because there are examples when people say that I did not smoke and then also I got lung cancer. But when we talk about smokers or people shifting to a more preventive lifestyle, how can small steps, in your daily routine ensure that you are leading a healthy life, and not only lung cancer, it's about, preventing obesity, keeping your blood pressure in check. How can one ensure that?
Right. So that's wonderful question. So modifiable and non-modifiable reasons for developing cancer. See what happens. I normally give them an example when patients come and ask me, I have not done anything wrong in my life. I have not eaten anything wrong in my life. I didn't hurt anyone. So why did I develop cancers? So it's like this. You're a disciplined driver. Okay, you have a car and you're a disciplined driver. The chances of having an accident are very minimal. If you're a rash driver, then there are 80% chances that you would get into a problem or an accident. But, disciplined driver still has 20% chances. So those are accidents. So modifiable things that we are consciously keep a watch on it. Like as you rightly said, don't put on too much of weight. Obesity is one reason. Do a regular exercise which protects you. All these 5 factors will protect you from 5 major diseases: cancer, heart attack, blood pressure, cerebrovascular accidents. So all these 5 major diabetes. So all these 5 major diseases are related to our lifestyle modifications. So please be conscious about these lifestyle changes that you can do. A proper balanced diet with less of non-veg, more of vegetarian diet, more of salad. Do not put on weight. Do not take too many calories so that you will put on weight. Less fat diet. These are the dietary changes. Good exercise of 30 to 45, regular exercise of 30 to 40 minutes. So those things would certainly help besides the smoking and tobacco chewing. Those are the main culprits. 35 to 40% of the preventable diseases are because of smoking and chewing tobacco. Besides that, these are the things. So non-modifiable things like genetically somebody is prone. As of now, there is no treatment for genetic modifications. So when you are known to have a predisposition, genetic predisposition, you should be conscious about it. You don't need to worry about it. Just be conscious and go for a regular screening, annual screening from the age of 30, 40 years. So more frequently after the age of 50. So that you should be consciously doing it. These are non-modifiable things. Do not worry about them. It can happen. Accidents do happen without our mistakes. So those things you should be aware, but don't be scared of them. So accidents, when they happen, think about it, go for investigations. Don't be scared of cancer. Just face it and you'll get rid of it.
Thank you, sir, for that answer. Coming to the post-treatment part, once the patient undergoes the treatment and he's all hale and hearty, what is the post-treatment journey like? What are some of the things that he needs to do?
Normally the treatment, unlike other cancers, you have maintenance. Other diseases like blood pressure, diabetes, you are a patient for lifelong. Whereas cancer is a one-time treatment, and once the treatment is done, you are asked to come every 3 months for the first 2 years. That's the standard follow for all cancers. So even for the lung cancer, once you complete 2 years, we make it less frequent, make it 6 months per visit. And once you complete 5 years, we declare you that you are cured of cancer. That's a normal standard procedure. But besides that, if the patient has got any problems, then certainly it should come earlier than that 3 months to 6 months period.
Right, Dr. Reddy. Coming to the, since we have talked about awareness, how preventive aspect of the disease, as a takeaway, what advice would you want to give our viewers who are watching us? What would you like them to know? Because, you know, especially the youngsters, because we are seeing cases of lung cancer in the younger population also. And when we talk about smoking, it's something that they feel that, you know, it is something empowering. So what advice would you want to convey to them?
First of all, lung cancer is a common condition. Unfortunately, more and more youngsters are getting into the habit of smoking. Especially, really surprising is young girls have become more because incidence of smoking has increased in young girls, unfortunately. So be conscious about it. There are so many good things available in life to have it. Please do not get habituated to smoking. One cigarette is equally dangerous. Do not say that I am taking only one or two cigarettes. So completely avoid smoking, and you can stop smoking even if you are a smoker. Take an oath and say then from this day I'm going to stop it, and it's practically possible, very much possible. I have seen so many people coming to us, and I counsel them at any point while I play, while I teach, while I sit somewhere. So I keep telling people to stop smoking, and it works. It definitely works. So people can stop smoking if they have the inclination to smoke. So you do proper counseling and talk to the smokers regularly at regular intervals, and they would certainly stop smoking. Youngsters especially should never take up smoking. Just smoking does not just cause cancers, it will trouble the entire body. You're going to develop cerebrovascular accidents, BP is going to go up, heart attacks, diabetes will become uncontrolled, you have claudication, muscle weakness. That advertisement that once you smoke becomes hero is absolutely wrong. You actually become zero. There are so many cases of impotence by constant smoking. So there are several bad ill effects of smoking. So never ever touch a cigarette, and never, if you are a smoker, please stop from today. That's the most important advice that I would like to give. Besides that, do not get scared of being diagnosed as cancer. Most of the times what we see is patients have symptoms, but they are scared of going to investigation because they think that probably I might get diagnosed of cancer. Actually, that is absolutely foolish. If you get any thought that you might have cancer, it's better to rush and get the investigations done. Every symptom does not mean that you have cancer, but it is better that even 1% of them, if you know that if you diagnose as cancer, you can get rid of them by simple treatments. Simple treatment, higher results, good results. We go for advanced stages, multimodality treatment, surgery, radiation, chemotherapy. Still, you are not sure that you're going to get rid of the cancer. So early diagnosis is mandatory. You spend money for your scooter, motorcycle for every 5,000 kilometers for servicing. Why don't you send your body also for servicing? It does not cost you more than what you spend for your motorcycle or car for servicing. So be conscious about your health. Health is the most important. It is billion dollars worth of life, $1 billion worth of your body. Don't neglect that. You be conscious about it. Do simple screening tests. Screening test does not mean that we are trying to promote and make money from the hospital. It is not in that view. Please think from your own angle. It does cost you 1,500 to 2,000 rupees to get a screening test done. Please be conscious and get these things done. And you will definitely keep fit. God bless you all. You're going to do well if you follow these simple steps.
Yes, thank you, sir. It indeed was a very insightful discussion, and in the most simple language, you have given us so much wealth of information. Thanks for being with us, taking out time from your busy schedule and joining us. And I'm sure that our audience got a lot of relevant information, and awareness sessions like these will go a long way in ensuring a more healthier society. Thanks for joining us today.
Pleasure. I would love to do many more such things, and you have been a wonderful host. God bless you.
Thank you, sir. Thank you. So that is all for today, everyone. Please keep following our social media pages for more updated information on health and well-being. Thanks for being with us.